Hi, my name is Tawo, and I'm going to be performing musculoskeletal examination of my patient today. Okay, I'm going to be meeting my patient just now. Hi, good day. How are you?
Fine, how are you?
Good, good. So, my name is Tawo. I'm going to be your nurse today, and I'm going to be performing musculoskeletal examination on you. All right. What is your name?
My name is Michael.
Michael. Okay. How old are you, Michael?
I'm 18 years old.
80 years old. Okay, so I'm going to be your nurse, and also I'm a family nurse practitioner student from United States University. Performing musculoskeletal examination on you today. What that means is checking your joints, your bones, and your range of motion from your part of your body to the lower part of your body. So, are you giving consent to go ahead with this examination?
Yes.
All right, and also to let you know that it's going to be uploaded on the YouTube for teaching purposes. Are you giving consent for that as well?
Yes.
All right, good, good. So before we get started, let me just wash my hands. All right, so I've washed my hands, so we're gonna get started. Then before we get started, do you have any pain anywhere in your body?
No.
Okay, you comfortable?
Yes.
All right, good, good. So the examination starts from your hand, and I'm gonna be inspecting your hand. In inspecting your hands, what I'm inspecting for is to check for any swelling. I'm checking for any deformity. I'm checking for any nodules. I'm also checking for any atrophy, that could indicate maybe one of your fingers is smaller than the other. And also, I'm also checking for any redness, any tenderness. Um, I don't see any swelling, and also checking for the skin of your fingers to check for any jaundice or any palish skin. All right, so I check for that, and I don't see any redness or swelling or any nodules. So the next thing is to also to palpate your fingers, to palpate from the distal and also to the proximal joints, and I'm palpating for any tenderness, any pain.
No pain.
Okay, any pain on this side?
No pain.
Does it feel tender at all?
No.
Okay, so good. All right. So let's check your thumb. Any pain here?
No.
All right. So the next thing we're gonna uh, do right now is also to palpate the metacarpophalangeal. Then to palpate the metacarpophalangeal, check for any redness, any tenderness, any pain at all.
No pain.
All right. Okay. So the next thing to do is to do a range of motion of your hand, of your fingers. Okay. And I'm gonna just demonstrate to you. You're gonna also do it with me. All right. So when I say the flexion, so the flexion of your hand is. Can you look at it? So you do your fingers together like this in 90 degrees angle. All right. Then extension. All right. Any pain when you do that? Okay.
No
Let's do
pain.
the left side as well. Okay. Any pain?
No pain.
All right. Then also, I want you to fan your fingers, which is abduction. Can you fan your fingers like this? Okay. Then them closer together, which is adduction. All right. Okay. Let's do the left side. Fan, abduction. Then bring together to the midline, which is adduction. Okay. Good. All right. Okay. So flexion, extension, flexion, extension, then adduction, abduction, then abduction, then adduction. All right. So the next thing to do is to um, uh, inspect your wrist. Okay, your wrist. What I'm inspecting for is also swelling. I'm also inspecting for any deformity, any redness, any atrophy or nodules, which could indicate carpal tunnel syndrome on both sides. And any pain there in your wrist?
No pain.
Okay. All right, so there's no swelling. So then I also palpating the metacarpals of your wrist. Metacarpals. I'm also palpating the carpals. I'm palpating also the edge of your uh, radius and ulna on both sides. Metacarpals, the carpals, the edge of your radius and ulna. Any pain?
No pain.
Okay. All right. So the next thing is to do a range of motion of your wrist. Okay, and we're going to do a flexion and extension like we did on the fingers as well. So flexion, flexion, then extension. All right, flexion, extension. Can you do it also for me? Then extension. All right, flexion, extension. Then we're going to do radial deviation, which is you're going to take your right wrist radial, you're going to put it towards you like this. Okay, radial deviation, then ulnar deviation. All right, let's decide on left side. Radial deviation, ulnar deviation, radial deviation, ulnar deviation. Okay, so then let's do the adduction and abduction of your wrist. So adduction, adduction, like you add. So it will come that everything is coming towards your body. So ad, adduction is like your wrist is coming towards your body like this. Okay. All right. Do it for me. Adduction, then abduction, going away. Okay. Then this side, adduction, then abduction. All right. So then we've done with that. So before we go to the next stage, there's a special test we're going to be doing while we're in your wrist area. It's called a tenet test. So the purpose of the tenet test is to check for any carpal tunnel syndrome, any carpal tunnel pain. So I'm going to have you hyperextend your wrist like this. Okay, you're going to hyperextend your wrist. Then why I also um, uh, apply a little pressure like a percus right here to check for any pain. Any pain?
No pain.
All right. Then hyperextend the left side. Okay, good. So, and all right. So that's a tenor sign test. Tenor sign test. So then the next one is to another special test on your wrist is called a phalanx test. So with the phalanx test, I'm going to have you bring your wrist together like this, like you want to pray, okay? And then you could, or you can also do it in a reverse prayer method like this. You bring it together like this. Then you hold it together for at least 40 to 60 seconds. You apply pressure together and you tell me if there's any pain right there. Any pain?
No pain.
Okay, so my patient is not positive of any tenant test or phalanx test. All right, so then we're gonna move to your elbow. Your elbow, what we're gonna be doing at your elbow is to first inspect. So I'm inspecting for any redness. I'm inspecting for swelling. I'm also inspecting for any joint symmetries. And I see that your elbows are symmetrical and there is no swelling, there is no redness, there is no effusion that could indicate a pocket of fluid in your elbow at all. So then the next thing is to palpate your elbow. So as I'm palpating uh, uh, laterally and medially on both sides, then also I'm going to palpate the olecranon process, which is the tip of your elbow right here. So palpate the olecranon process for any pain. Any pain right here?
No pain.
All right, let's do the other side. All right. Then also I'm going to palpate the lateral and medial epicondyles. So the lateral epicondyles right here, and the medial epicondyles right here. Any pain?
No pain.
Okay. Medial epicondyles and then lateral epicondyles. Okay, so there's no pain that could indicate any what we call a tennis elbow or medial or lateral epicondylitis. Okay, so and also um, uh, a pain over there could also indicate Govers or baseball elbow. But the difference is that if my patient have pain in the media, as the media is being palpated, that is what they call Govers elbow or baseball elbow. Govers elbow or baseball elbow, and that's an indication of media epicondylitis. But if the patient uh, have pain in the lateral epicondylitis while it is being palpated, that is what we call a tennis elbow. So just want to make point out the difference between those two. So the next thing we're going to do now is to do the range of motion of the elbow. So with the range of motion of the elbow, like we did on the wrist, okay, so we're going to do flexion, extension. So flexion of the elbow, you bring it to 90 degrees, okay, all right, then extension right there, okay, then let's do that. Flexion, then extension, flexion, extension. So then there's another the two tests now with elbow, which we call supination and pronation. Supination is like when you sleep with your face facing up, so you bring your elbow like this, so with your palm facing up. Supination, then pronation. Supination, pronation. Okay, let's do this one. Supination, pronation. Supination, pronation. All right, good. So then another one we're going to do is so the abduction, no, adduction, abduction, adduction, abduction, adduction, abduction, adduction, abduction. All right, so that is that about elbow. So the next place we're going to come to is the inspection of your shoulders. Okay, so we're going to be I'm going to be inspecting your shoulders. So what I'm inspecting for is to check for I'm going to inspect both bilaterally and posteriorly and anteriorly, checking for any swelling in the scapular area or in this scapular process. Also checking for any nodules, checking for joint symmetry. So it looks like your shoulders are symmetrical and there is no growth deformity. One shoulder is not higher than the other, and then the skin of your shoulder, uh, there's no yellowish discoloration, and there's no uh, jaundice or palish skin. So the next thing is to palpate. Then I'm going to be palpating, noting for any tenderness. So palpating, checking for any tenderness, any pain. So I'm palpating the acroclavicular joint, or which we call AC joints. The AC joint right uh, by uh, the scapula and the clavicular meets. So the AC joint is right where the clavicular and the scapula meet. So the AC, then palpating for that, and below the AC joint is the just right there, just right below the AC joint is the caracoroid process, and palpating that for any tenderness on both sides. Below the AC joint is the caracoroid process, palpating that for any tenderness, and also the subdeltoid subdeltoid bursa. I'm palpating that just right below the deltoid muscle here. And bursa, any pain, just tell me as I'm palpating all this.
Okay.
Okay. Then I'm also palpating the bicep groove. The bicep groove right here, we to trace from the bicep muscle right here all the way here. There's and the bicep groove is right here. So palpating that for any tenderness and both and the right side as well. Then also the subtendous bursa, palpating that as well for tenderness or any pain or any swelling. So there's no pain, right?
Okay.
No tenderness. Okay, so the next thing we're going to do is to do the range of motion of the shoulders. So the range of motion of the shoulders, we're going to do flexion. So which I'm going to have you have your hand in like in 180 degrees. Okay, uh, so you're gonna have it forward. So flexion right here. You do it this way. So flexion, then extension of your shoulder is actually when you bring your hand all the way to your back. All right. Okay. Flexion, extension. Then let's do the right side like that. Flexion, then extension. Okay, good. So the next thing is to do abduction and adduction. So abduction is when you take away, abduct. So, okay, so abduction, then adduction, abduction and adduction. On this side, abduction, adduction, abduction and abduction. As we're doing this, tell me if you have any pain. Okay, abduction, adduction.
Okay.
All right. So let's do it one more time. Abduction, adduction. All right. So we're gonna move to the next. The next one is gonna. Let's move to the next one, which is gonna be internal rotation and also external rotation of your of your shoulder. So with the internal rotation, which we can also call a scratch test, I'm gonna have you uh, uh, okay, let me do the internal rotation first. With the internal rotation, so I'm going to just move to internal rotation, then external rotation, internal rotation, external rotation, then this side, internal rotation, external rotation, external rotation. So this also could check for any rotator cuff. A pain there could be a sign of any rotator cuff that could be you know uh, that could be noted during this examination. So then what the another thing is I'm going to have you, this is what we call a scratch test. So I'm going to have you take your hand all the way to the other side. All right. Okay, the other side of your scapula. Okay, let's see you in video. All right, then this one as well. Okay, so which we call a scratch test. Okay, so the one of the tests I'm going to do for you is called speed test. With the speed test, I'm going to have you stretch forth your hands, like you flex your two hands, and I'm going to apply pressure. So don't let me pull your hands down. Okay, so and with this, I'm putting pressure on your bicep groove to elicit any pain. Any pain?
Okay.
Any pain? All right. So there's that also that test to test for any rotator cuff injury. and so my patient is not positive of any rotator cuff injury. So I've done the scratch test, and then the other test I want to do is what we call near test, NEER test. So with this one, uh, I'm gonna when your shoulder move, uh, so when you move your hand, your shoulder move with you. But I'm gonna place my hand here, and as you move your hand up, so I'm gonna be place my hand there to pull your shoulder back, and you tell me if there's any pain. Okay, lift your hand up. Any pain?
No pain.
Any pain?
No pain.
So that's a near test. Okay, all right. Any pain?
No pain.
Any pain?
No pain.
All right. So let's that's a near test. The near test also is to test for any rotator cuff injury. So let's go to the next test as we rounding up with the shoulder assessment. So this one is called Hodgkin test. So with the Hodgkin test, I'm going to have my patient flex his shoulder. His elbow, gently and over the shoulder. So with this one, so you're gonna flex your elbow over the shoulder, and then all the way like this, okay, over the shoulder, and then so with this, let me do it on this side. It's much better for me on this side. Then with this one, if there's any rotator cuff my patient will experience, once I press slightly over his shoulder, he will experience some pain. Okay, all right, flex your hand, elbow. Okay, any pain?
No pain.
All right. So, and the last test is to check for apprehension test. With the apprehension test, I just want to have my patient, put your hand in a baseball pitcher position, when like you want to play the baseball. Okay. So with that, I want to also apply a little pressure and to see if there is any pain on his face or any apprehension on his face. All right. So there's no evidence of rotator or cuff. So the last test I'm going to do on the shoulder is what we call the drop arm test. With the drop arm test, I'm going to have my patient, you know, abducts, like you take your hands away like this, like you're flagging down a cab. All right, this way. All right, and then you lower your you slowly lower the arm down. So you slowly lower it down. Okay, so as you are lowering it down, you tell me if you will feel any pain as you're lowering down.
No pain.
Okay, so if there's a rotator cuff injury, it will elicit pain as it was lowering his arm down gently like that. So there is no evidence of rotator cuff. But do it on the other side. Okay, then you lower it down slowly like that. Okay, all right. So what we're gonna do next is a spine examination. And with the spine examination, it involves the head, the neck, and so we're gonna start from the neck. Okay, so as I start from the neck, I want to inspect your neck for any deformity. I want to also check for any tenderness. I want to check for any nodules. I want to also check that the trach is at the midline. I want to check for symmetry. So, and it looks like your neck is supple and there's no deformity. There is no swelling, and is symmetrical on both sides. So then the next thing is to palpate uh, the neck and also check for the the front of the technos, and as I'm doing this with my two fingers, okay, so and then part of that is also I'm gonna also uh, move from this side to the head, and also uh, check for your temporomandibular joints, okay, because part of the uh, spine examination is the head and the neck. So palpating the temporomandibular uh, uh, joint here, and I'm going to have you open your mouth and close your mouth gently. Open your mouth, close your mouth. Then I'm going to have you open your mouth against resistance as I do this. Okay, do it again. So, and the palpation is also to check for any temporal mandibular tenderness. Okay, then also I'm palpating for the paraclavicular, and also I'm palpating for steno clavicular and the cervical spine to check for any tenderness and any pain at all.
No
All
pain.
right, good. Okay, so part of the range of motion is when I ask you to just open your mouth with my two fingers. You're gonna open it against resistance. Okay, then I'm gonna have you you know, move your head to both sides. Let me see, as you flex your neck. Okay, then tuck your, okay, so as you, that's a flexion of your neck. Then move it to the back. Then extension. Okay. Then both sideways. Okay. All right. So rotate the neck both sideways one more time. Okay. Then also check for the lateral movement. I want to have you, your right side will talk to your ear. All right. Then the left side talk to your ears. Okay. And you do both sides. So any pain as we doing that.
Okay.
All right. So the special test to do at this side is what we call spalling test or compression test. So your neck in extension position, you're gonna uh your neck on that side, and you bend it laterally. Okay. So supposedly there's you complain of pain on one side. So as you extend your neck, neck in extended position, and you bend it laterally on to the side, to the affected side. Let's say your right side is the affected side, so it exerts compression of pain. So, and any pain on any side at all? No. Okay. Then do on both sides. Extend your neck. And okay, good. Okay. So the next thing um is to go to your feet. Okay. So let's do your feet. So we're gonna do your feet, and what I'm gonna be checking for in the feet is I'm gonna be checking uh inspection first, inspection of your feet, inspection for any deformity, any swelling. I'm checking also for calluses. I'm checking also for any bunions. I'm checking for any evidence of gout on both sides. And there is no bunions, there is no calluses, there is no abnormal growth, and uh, there's no abnormal growth. Then the next thing is to palpate. Palpate. You want to lay back to be more convenient for you. All right. Can we see it in the video? Okay, good. So the next thing is to palpate your distal. Okay. Palpate the distal, and the proximal interphalangeals. Okay, and I'm palpate for any tenderness of the distal and proximal interphalanges on both sides, and metatarsus. Okay, so and also I'm palpating for any metatarsal for any tenderness. So any pain at all?
No pain.
All right, good. So the next thing is to do range of motion. Range of motion of his feet. So we're going to do flexion of your toes, and also an extension of your toes. Okay, flexion. You do your toes like this. Okay, then extension, flexion, extension. Then also uh, inversion of the foot. You're gonna move it inward, like invert foot, evert foot, invert inside, evert. All right. So I want to come to the side of the bed so I can do dorsiflexion and plantar flexion. So dorsiflexion and plantar flexion. So dorsal, then plantar down. On both sides, dorsal and plantar. Okay. All right. So then let's do your ankles. With the ankles, I want to inspect your ankles for any swelling. I'm also inspecting for any nodules and any deformity. As we do that, I don't see any swelling, um, which could also indicate any form of arthritis or bone deformity. Also, I want to. Then the next thing is to palpate the malleolus and the medial malleolus of the ankle, the medial malleolus and the lateral malleolus. Any pain as we do this?
No pain.
All right. So the medial malleolus of the ankle here. Any pain here?
No pain.
Then the lateral malleolus of the ankle. All right. So let's do a range of motion of your ankle. And so as you're going to do the range of motion, that's where we do the dorsiflexion and plantar flexion. Okay. So the dorsiflexion, you're going to flex your ankle up. Then the plantar, you bring it down. Okay. Dorsiflexion, plantar flexion. Dorsiflexion, plantar flexion. Okay. Dorsiflexion, plantar flexion. Dorsiflexion, plantar flexion. Okay. All right. So you're doing good. All right. You comfortable?
Yes.
Oh, okay. Good, good. So the next thing is to do the examination of your knees. Okay. With the examination of your knees, what you're going to do inspection first. What I'm inspecting for is also inspecting for swelling. I'm also inspecting for any swelling could indicate effusion to see if there's any fluid pocketing in your knees. And also I'm inspecting for any nodules. I'm inspecting for any swelling. I don't see any swelling. I don't see any redness. I don't see any deformity of your knee. So then the next thing we're going to do in the knees is also to palpate the knees. Okay, we're going to palpate the both lateral and medial part of the knees, and I'm going to palpate the supra patella. Okay, pouch. The patella is your kneecap right here. Okay, so palpating the supra patella pouch, and also palpating for the popliteal area. So with the popliteal area, what I'm going to palpate for is to check for any Baker cyst. I'm going to have you stand up. So Baker cyst, when I palpate here, is like if I palpate uh, any swelling that feel like a ball, that's a Baker cyst, and I don't see any feel like that here. Okay, so and palpating the lateral parts of the patella, and also to check for meniscus uh, disease, which could be there, but everything looks normal. So then the next thing is to do range of motion of your knees. Okay, so we're going to do extension and flexion. Okay, extension. So extension, let's do the extension of your knees and flexion. Extend, flexion. Okay, so the flexion is this way. Okay, extend, flexion. Okay, this side, extend, flexion. Okay, let's do adduction and abduction. Okay, adduction, abduction, adduction, abduction, adduction, abduction, 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 adduction. Let's do it one more time. Adduction, abduction. All right. So that's the range of motion, of your knees. Okay, so the special test to do while we're on your knees is what we call the various stress test and valgus test. So with the various tests, I'm gonna have you be in supine position, the laying down position. Okay. So with this one, I'm gonna. Oh, is it? Can I see the video? Is it okay? Let me adjust the camera. Okay. So with this one, I'm gonna have my hand just right in the distal part of your femur, and also my other hand in uh, 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 the lateral part, or no, the medial part of your ankle. Okay, so then I'm gonna adduct. So if there's this is to just to determine any meniscus injury. So as I adduct, if there's any meniscus injury as I adduct, it will elicit pain. So as I adduct, okay, any pain?
No pain.
Okay. Then the valgus is also with the let's do the varus stress on the other side. Okay. My hand here, then my other hand, the medial, no, inner part of your ankle. Then I adduct the knee. All right. Okay. So with the valgus one, is my hand on the distal part of his femur, and my other hand will be at the lateral part of his ankle. And with this one, I'm gonna just adduct the knee of the patient uh, to check for any pain. Any pain?
No pain.
Okay. So any pain?
No pain.
So there's no indication of any meniscus injury. So the other test to do here on the knee area is what we call anterior and posterior drawer test. So we are anterior and posterior drawer test. I'm going to have you flex your knee, okay, with my palm of my hand. So I'm going to apply pressure like I'm anteriorly. Apply pressure. I'm putting your knee towards me. Okay, so that is an anterior drawer test. Okay, so you tell me if there's any pain. It will be like just I'm opening a door. Any pain?
No pain.
Okay, then the posterior part of it is I'm going to be uh, pushing your knee towards you. Any pain?
No pain.
Okay, let's do the other side. Okay, anterior. Any pain?
No pain.
Then posterior. Any pain? All right. So the patient is negative of anterior and posterior draw test, uh, which rule out any meniscus injury. Then the next one is to test for the Lachman test. So I'm going to have you flex your flex your knee gently, okay, like in a 20 degrees. Then my dominant hand will be at the tip of your femur, while my non-dominant hand will be at your tibia tuberosity. And also, I'm going to just assess laxity anteriorly and posteriorly, just to check for any ligaments pain. Okay, so this is called Lachman test. This is called Lachman test. Any pain?
Pain.
Okay, let's decide. Any pain?
No pain.
Okay. All right. So the last test, special test on the knee side is McMurray test. So with the patient still in supine position, I still want you to be your supine position. We're gonna just rotate your knee medially. While you extend your knees. So I'm gonna just rotate your knees medially. Okay. And this is just also looking for laxity or pain or crepitus. So crepitus like when the bones are grinding each other. Any pain at all? Okay, all right. So we've done with the knees examination. So the next place we're going to go to is the hip. So with the hip examination, so what I'm going to be doing is let's give you some privacy here. Is just to first inspect. We're going to inspect the hip. We inspect for any swelling. We inspect for any redness. We inspect for any nodules. We also inspect for anything that could elicit pain in that area. Any pain in upon your knees area?
No.
All right. So after this inspection of the knees, so the next thing is to ensure that like you can see rightly that my patient have to be in a supine position, and also so that the knee examination, which include range of motion, could be easily performed. So one of the areas we're going to look at when it comes to palpation is to palpate the I'm going to have you turn to your side a little bit. So to palpate the anterior superior iliac spine, or ACIS. So anterior superior iliac spine. So which is right there by the tuberosity iliac. Then any pain as I do the palpation here?
No pain.
Okay, good. So also I'm going to also palpate the superior iliac. Okay, and then also what I'm palpating for is any tenderness in the area. Then also I'm palpating for any the posterior iliac spine, which is also called PSIS. Okay, we did the anterior. We're gonna also do the we did the anterior here. We're also going to do the posterior, which there's no evidence of pain. So let's do range of motion, which is a flexion and also extension. Okay, flexion and extension of your hip. flexion and extension of your hip. So with the flexion, I'm going to have you raise your feet all the way. Okay, all right. So then extension of your hip is actually, can you lay down and face back? So extension is when you move your, no, the whole leg, you move, right, move it away from your body. Okay, good. Then do both side extension. All right. Okay, so then turn to your side again. So the next thing is to do the adduction and abduction. Okay, abduction is when we take the hip away from your body. Abduction, then adduction. Abduction, then adduction. Then let's do the other side. Abduction and adduction. Abduction and adduction. Then to do the internal rotation and external rotation. Okay, so with the internal rotation, you take your hip all the way in and then all the way out. External rotation. In, out. Then the other side. Internal rotation. In, out. All right. So I think we are done with that. And then the special test to do here is what we call Thomas test. Thomas test is to dictate for any occult hip flexion or contraction. So with this, I'm going to have you flex your knee, your your knee, and pull firmly against the abdomen. Okay, you're going to flex your knee. Okay, and pull. I'm going to pull firmly against the abdomen. Okay. So this is what we call Thomas test. Let's do it on the other side. So flex your knee. So this test flattens the or you check for any lumbar lordosis. Yeah, yeah. Okay, good. So then the next one is the next special test is a Faber test or figure 4 test. With the Faber test or figure 4 test, let's have the video. With Faber test or figure 4 test, so we what this one is about is to abduct abducting external rotation of the hip and test for hip or. So I'm going to have you with your hip, you're going to abduct the hip. Okay, so abduct the hip, then with the external rotation, hold on, of the hip. So this is just to check for any joint disease. Okay, all right. And then I think that's the test right there for so then uh, why you with this test, I'm going to do it one more time. Okay, so with the Faber test, so I'm going to have you so your leg should actually, yes, be in the position just right by your knees. Okay, then I'm going to apply pressure here. All right, so and it will let me know if there's any pain. Okay, any pain? All right, good. So so that's Thomas test. So then let's do the spine test. Okay, to examine your spine. With that, I'm going to have you stand on your feet. Okay. So with this spine test, the first thing is to inspect. So I'm inspecting the curvature of the spine. So inspecting the curvature of the spine while the patient is in standing position, and also to check if the spine have a normal curvature, and the normal curvature of the spine should be in a S shape, which is a concave, then the convex and the concave uh, uh, curvature, which uh, we see here. Otherwise, kyphosis or scoliosis could uh, make it to be deformed and not have that uh, curvature. So I don't. Also, we check inspecting for any swelling, any deformity. Then also checking for any uh, abnormal growth. Checking for the shoulder height and also the symmetry of the shoulder, and checking for any iliac crest symmetry, which are symmetrical. Then also inspecting the overall part of the spine while it's still in this standing position, checking for the skin, the color of the skin, and also checking for any any uh, part of this buttocks, making sure that there is no swelling or any form of abnormality. Okay, so then the next thing is to palpate the spine. So as palpate the spine using the on space to palpate for any tenderness, using the fist of my own uh, for any tenderness as we then uh, from then checking for any tenderness or any pain. Okay, so there's no uh, any form of pain. So then we're going to do range of motion of the spine. I'm going to have you bend down. I'm going to have you touch your toes. All right. So with this one as well. Um, uh, so then uh, that's then part of what I'm also going to do here is, is to also, why I have him in this position, check for the symmetry of his scapula. So then while you bend there, then I'm going to also have you do a lateral movement and both sides, sway to the right and sway to the left. Okay, and also do that twist. Okay, so then with the after we've done the flexion, which you have bent down, the flexion, then also I'm going to do the extension. Okay, all right, good. So then what we're going to do is let's do a straight leg test. I'm going to have you back in bed. Okay, I'm going to have you back in bed. Be still in this position. So can you, with the spine, can you shrug your shoulders for me? Okay, all right. So with the, okay, then lay back. Let's do the straight leg test. So with the straight leg test, you move one of your feet all the way in about 40, your feet, your, your foot in about 45 degrees angle all the way up. Okay. Any pain?
Okay.
Okay. Then let's do this one. The straight leg test. Okay. A little bit. Okay. And then repeat this one again. All right. So this straight leg test is also negative. So the straight leg test is negative. Okay, so let's do uh, the next one. Let's do the next one. So what I'm gonna just do right now is so then that concludes the that concludes the musculoskeletal examination that I've done on my patient today, and it's pretty a long test or examination with a lot of information to touch. I want to thank my patient for his patience tonight, and thank you so much. We'll see you next time.
No problem.